Single neuron recording, ChatGPT said. Here is your CSIR-Net Life Sciences focused high-quality theory lecture on single neuron recording, tailored for maximum conceptual clarity, exam relevance, and inclusive of previous year questions with answers with year for solid preparation. Single neuron recording Introduction. Single neuron recording is a powerful electrophysiological technique used to detect and analyze the electrical activity of individual neurons. It is crucial for understanding the functional properties of neurons, including how they encode sensory stimuli, respond to inputs, and participate in neural circuits. This technique has been pivotal in neurophysiology, cognitive neuroscience, and brain-computer interface research. 2. Principles of single neuron recording. A microelectrode is inserted near or into a single neuron. Records action potentials, spikes generated by that specific neuron. The neuron's electrical activity is isolated from surrounding cells by careful positioning and signal discrimination. The electrode typically has a tip diameter of approximately 1 micrometer, ensuring high spatial resolution. 3. Types of single neuron recordings. 1. Extracellular recording. Electrode is placed just outside the neuron. Record spikes action potentials and sometimes local field potentials. Non-invasive to intracellular content, less disruptive. Common in awake behaving animals or in vivo studies. 2. Intracellular recording. Electrode penetrates the neuron's membrane. Measures resting potential, graded potentials, and action potentials. Provides detailed information that is invasive and technically challenging. 3. Juxtacellular recording. Electrode is placed very close to the cell but without penetrating it. Offers a compromise between extracellular and intracellular recording. IV. Electrode types. Glass microelectrodes for intracellular recording filled with electrolyte solution. Tungsten platinum iridium electrodes for extracellular recording durable and reusable. Silicon-based microelectrodes e.g., UDA or A used for multi-unit or long-term recordings. The applications of single neuron recording sensory physiology. Mapping receptive fields in visual, auditory, or somatosensory systems. Studying neuron responses to specific stimuli, light, sound, touch. Cognitive neuroscience. Correlating neuronal firing with decision-making, attention, learning, or memory. Observing neuron activity during specific behavioral tasks. Motor control. Understanding how motor neurons and premotor areas encode movement intentions. Brain-machine interfaces. Real-time decoding of action potentials for controlling prosthetics. Pharmacological studies. Observing how drugs or neurotransmitters modulate neuronal firing patterns. P. Data analysis and single neuron recording. Spike sorting, differentiating action potentials from different neurons based on shape and timing. Firing rate analysis, quantifying neuron output as spikes per second. Peristimulus time histogram PSTH measures average neuronal response to a repeated stimulus. Raster plots, visualize spike timing across multiple trials. 7. Limitations and challenges. Difficult to maintain stable recordings over long durations. May not capture the full picture of network-level dynamics. Intracellular methods risk damaging the cell. Interpretation can be biased by selection of highly active neurons. 8. CSIR-Net relevant key points. Extracellular recordings are best for awake, behaving animals. Intracellular recordings provide more detailed potential changes. Spike sorting and PSTH are essential for interpreting results. Single-unit recordings contributed to receptive field mapping in Nobel-winning work Hubel and Wiesel. Ix. Previous year CSIR-Net questions 1. CSIR-Net Deck 2016. Which of the following techniques would be most appropriate to study the firing pattern of an individual neuron in an awake behaving monkey? A. Intracellular patch clamp recording. B. Extracellular single-unit recording. C. D. fMRI. Answer. B. Extracellular single-unit recording. 2. CSIR-Net June 2018. A neuroscientist is studying the stimulus-specific firing of neurons in the visual cortex of a primate. Which of the following methods is most likely being used? A multi-electrode array recording. B. Patch clamp in whole cell mode. C. Single neuron extracellular recording. D. Electroretinography. Answer. C. Single neuron extracellular recording. Would you like the next lecture on fluorescence techniques e.g., GFP, FRAP, FRET, or a different method like flow cytometry or molecular biology techniques e.g., PCR, Southern Blot for CSIR-Net? You said. Patch clamp recording, ChatGPT said. Here is your high-quality, CSIR-Net Life Sciences-oriented lecture on patch clamp recording, written with maximum conceptual depth, key points for the exam, and previous year questions with answers in years to reinforce understanding and boost your score. Patch clamp recording Introduction. Patch clamp recording is one of the most powerful and precise techniques in electrophysiology for studying the electrical properties of individual ion channels and entire cells. Developed by Erwin Neher and Bert Sackman, it revolutionized our understanding of ion channel dynamics, earning them the Nobel Prize in Physiology or Medicine in 1991. 2. Principle. The patch clamp technique uses a glass micropipette electrode with a very fine tip, approximately 1 micrometer diameter, to form a tight gigaohm seal with the cell membrane. By controlling the membrane voltage and measuring ionic currents, this technique reveals ion channel activity, membrane potential dynamics, synaptic responses, pharmacological effects on ion channels. 3. Configurations of patch clamp recording. 1. Cell-attached mode. Pipette is sealed onto a small patch of membrane. Records activity of ion channels within that patch without disrupting the intracellular environment. Ideal for observing native ion channel behavior. 2. Whole cell configuration. Suction or pulse ruptures the membrane under the pipette tip. Electrode gains access to the entire cytoplasmic space. Allows measurement of whole cell currents, membrane capacitance, and cytoplasmic manipulation. 3. Inside-out patch. Patch is pulled off from a cell while remaining attached to pipette. Intracellular site is exposed to the external solution. Used to study the effects of cytoplasmic factors or drugs. 4. Outside-out patch. After forming whole cell configuration, the pipette is slowly withdrawn, causing the membrane to reseal. Extracellular site faces the bath. Useful for testing neurotransmitters, toxins, and ligands acting on extracellular domains. IV. Applications ion channel biophysics. Current voltage IV relationships. Gating kinetics and conductance states. Pharmacology. Drug screening for channel modulators. Understanding toxin or hormone effects. Neuroscience. Synaptic transmission mechanisms. Action potential dynamics. Cardiac and muscle physiology. Study of calcium, sodium, potassium, and chloride currents. Developmental and cell signaling studies. Calcium-activated channels. Mechanosensitive ion channels. The experimental requirements micromanipulators and amplifiers for precision control. Low noise environment. Silver chloride electrodes and electrolyte-filled pipettes. Voltage clamp or current clamp modes. The advantages. High resolution, can detect single ion channel openings. Versatility, multiple configurations allow various experimental manipulations. Quantitative, provides accurate current and conductance data. 7. Limitations. Technically challenging and requires expertise. Access to intracellular content may disrupt cell physiology, especially in whole cell. Some cells are difficult to patch, e.g., very small or modal cells. 8. CSIR net relevant key points. Whole cell patch clamp is used to measure global cell membrane currents. Cell-attached configuration keeps intracellular contents intact. Inside-out and outside-out modes allow exposure to different sides of membrane. Widely used for electrophysiological studies of neurons, cardiomyocytes, and ion channels. Patch clamp can resolve single ion channel behavior, unlike conventional voltage clamp. Ix. Previous year CSIR net questions 1. CSIR net deck 2019. Which of the following techniques is best suited to study the activity of a single ion channel? A voltage clamp recording. B patch clamp in cell attached mode. See calcium imaging electroencephalography. Answer. B patch clamp in cell attached mode. 2. CSIR net June 2021. In a patch clamp experiment, if the pipette is withdrawn slowly after achieving whole cell mode, the patch formed is known as an inside-out patch. B cell attached patch. C outside-out patch. D on cell patch. Answer. C outside-out patch. 3. CSIR net deck 2018. Which of the following is true about patch clamp technique? A. It can only be used on plant cells. B. It cannot be used to study ion channel kinetics. C. It allows single-channel current recordings. D. It records only from cell populations, not individual cells. Answer. C. It allows single-channel current recordings. Would you like to continue with fluorescence techniques, e.g., GFP, FRET, FRAP, or move on to flow cytometry or PCR, Southern blot next? You said, ECG. ChatGPT said. Here is your CSIR Net Life Sciences oriented, high-quality theory lecture on ECG electrocardiogram, structured with detailed conceptual clarity, key points, and previous year questions with answers with ear to strengthen exam preparation. Electrocardiogram ECG I Introduction. An electrocardiogram ECG or EKG is a non-invasive diagnostic technique that records the electrical activity of the heart over time using surface electrodes. It provides critical information about cardiac rhythm, conduction system, and helps diagnose arrhythmias, myocardial infarction, and other heart disorders. 2. Basic principle. The heart generates electrical impulses that cause cardiac muscle contraction. These impulses originate in the sinoatrial SOT node, spread through the atria, pass through the atrioventricular AV node, and down the bundle of his to the Purkinje fibers. ECG detects these voltage differences on the skin surface due to depolarization and repolarization of cardiac tissue. 3. ECG lead systems 1. Limb leads bipolar, lead eye, right arm to left arm. Lead 2. Right arm to left leg. Lead 3. Left arm to left leg. 2. Augmented limb leads unipolar, AVR, AVL, AVF. 3. Chest precordial leads unipolar, V1 to V6, placed across the chest to record horizontal plane activity. These 12 leads provide a comprehensive view of the heart's electrical activity in multiple planes. IV. Waves and intervals in a normal ECG P wave, atrial depolarization. QRS complex, ventricular depolarization. T wave, ventricular repolarization. PR interval, time from atrial to ventricular activation, AV conduction. ST segment, ventricular depolarization ending to beginning of repolarization. QT interval, total time for ventricular depolarization and repolarization. V applications of ECG diagnosis of arrhythmias. Tachycardia, bradycardia, atrial fibrillation, etc. Myocardial infarction, MI. ST elevation or depression indicates ischemia or infarction. Conduction abnormalities. Bundle branch blocks, AV blocks. Electrolyte imbalances. Hyperkalemia shows peak T waves, hypokalemia flattens T waves. Drug effects. Prolonged QT with certain drugs, quinidine, sotalol. Pacemaker function evaluation. V. Advantages. Non-invasive, quick, and inexpensive. Can be performed at bedside or in emergency settings. Provides real-time data. 7. Limitations. Only records electrical activity, not mechanical contraction. Interpretation can be affected by body position, electrode placement, or artifacts. May require correlation with clinical symptoms or imaging for accurate diagnosis. 8. CSIR net relevant key points. P wave, atrial depolarization. QRS complex, ventricular depolarization. T wave, ventricular repolarization. ECG is a surface recording, not an intracellular or single neuron method. Differences in ion channel activity, e.g., Na, K, Ca squared, affect ECG features. Ix. Previous year CSIR net questions 1. CSIR net deck 2017. The T wave in an ECG represents which of the following? A. Atrial repolarization. B. Ventricular depolarization. C. Ventricular repolarization. D. Atrial depolarization. Answer. C. Ventricular repolarization. 2. CSIR net June 2020. Which of the following statements about ECG is true? A. It records heart sounds. B. It directly measures myocardial contraction. C. It reflects the electrical activity of the heart. D. It measures blood flow in coronary arteries. Answer. C. It reflects the electrical activity of the heart. 3. CSIR net December 2015. A prolonged PR interval in an ECG is indicative of A. Atrial fibrillation. B. First degree heart block. C. Ventricular tachycardia. D. Myocardial infarction. Answer. B. First degree heart block. Would you like to continue with the next electrophysiological method like electroencephalography, E, or proceed to fluorescence techniques, GFP, FRET, FRAP next? You said. Brain activity recording. ChatGPT said. Here is your CSIR Net Life Sciences oriented, high-quality theory lecture on brain activity recording, tailored with maximum conceptual depth, previous year questions with answers, and exam-relevant insights. Brain activity recording. Introduction. Recording brain activity is fundamental in neuroscience for understanding how the brain processes information, coordinates behavior, and responds to stimuli. These techniques allow researchers to measure electrical, magnetic, or metabolic signals from neurons or brain regions, providing insights into neural function, cognition, behavior, and disease. 2. Major brain activity recording techniques. 1. Electroencephalography (EEG). Records electrical activity from the brain using electrodes placed on the scalp. Measures some postsynaptic potentials mainly from cortical pyramidal neurons. Signals are weak till the microvolts and oscillatory, classified by frequency bands. Delta 0.5-4 Hz deep sleep. Theta 4-8 Hz drowsiness, meditation. Alpha 8-13 Hz relaxed wakefulness. Beta 13-30 Hz active thinking. Gamma and GT 30 Hz cognitive functions. Advantages. Non-invasive, inexpensive, real-time data. Limitations. Poor spatial resolution. Poor spatial resolution. Only records surface cortical activity. 2. Magnetoencephalography (MEG). Records magnetic fields generated by neuronal activity using SQUIDs, superconducting quantum interference devices. Has better spatial resolution than EEG and is highly sensitive to tangential cortical activity. 3. Electrocorticography (ECOG). Invasive method. Electrodes are placed directly on the cortical surface. Offers high temporal and spatial resolution. Used during neurosurgery, e.g., epilepsy surgery. 4. Intracranial electrode recordings. Includes depth electrodes inserted into brain regions, e.g., hippocampus. Used in research and clinical settings for disorders like epilepsy. Records from single neurons or small neuronal clusters. 5. Functional magnetic resonance imaging (fMRI) measures both blood oxygen level dependent signal. Reflects changes in blood flow and oxygenation, indirectly indicating neuronal activity. High spatial but low temporal resolution. Useful for mapping brain function, e.g., language, emotion, sensory input. 6. Positron emission tomography (PET) uses radioactive tracers to visualize metabolic activity. Often used for neurotransmitter mapping, glucose uptake studies, and neurodegenerative disorders. 3. Experimental considerations. Animal models versus human studies. Invasive methods are mostly used in animals or surgical cases. Signal analysis requires filtering, Fourier transformation, event-related potential ERP extraction. Ethical considerations, especially for invasive methods. IV applications in research and medicine diagnosis and monitoring. Epilepsy (EEG, ECOG). Sleep disorders. Alzheimer's disease (PET). Brain tumors (fMRI, PET). Brain-machine interfaces. EEG-based neuroprosthetics. Cognitive neuroscience. Understanding attention, learning, memory. Pharmacological testing. Effects of drugs on brain activity. VCSIR-net relevant key points. EEG is used to record postsynaptic potentials, not action potentials. MEG has better spatial resolution than EEG but is expensive. fMRI is based on hemodynamic changes, not direct electrical activity. Invasive methods ECOG, depth electrodes give higher resolution than scalp recordings. Previous year CSIR-net questions 1. CSIR-net Deck 2020. Which of the following techniques measures magnetic fields produced by brain activity? A. EEG. B. fMRI. C. PET. D. MEG. Answer, D. MEG. 2. CSIR-net June 2019. EEG primarily reflects action potentials from deep brain nuclei. B. Magnetic activity in the brain. C. Postsynaptic potentials from cortical neurons. D. Cerebrospinal fluid movement. Answer, C. Postsynaptic potentials from cortical neurons. 3. CSIR-net Deck 2016. Which of the following is a non-invasive technique to monitor blood flow changes in the brain associated with neural activity? A. ECOG. B. Intracranial electrode. C. fMRI. D. Patch clamp recording. Answer, C. fMRI. Would you like to proceed with fluorescence techniques GFP, FRET, FRAP next, or should we move to molecular techniques like PCR, blotting, or flow cytometry? You said, lesion. And stimulation of brain. ChatGPT said. Here is your CSIR-net Life Sciences-oriented, high-quality theory lecture on lesion and stimulation of brain, with detailed conceptual clarity, key techniques, applications, and CSIR-net previous year questions with answers included. Lesion and stimulation of brain. Introduction. Lesion and stimulation techniques are powerful experimental methods in neuroscience used to investigate structure-function relationships in the brain. Lesion techniques involve damaging or removing specific brain areas to study the resulting behavioral or physiological changes. Stimulation techniques involve activating certain brain regions to assess their role in behavior or physiology. 2. Lesion techniques. The types of lesions. Ablation, surgical removal or destruction of a brain region. Electrolytic lesions, high-frequency electric current applied via electrode destroys tissue. Excitotoxic lesions, use of chemical agents e.g., canic acid, ibotenic acid that overactivate neurons and cause cell death without damaging fibers of passage. Reversible lesions, temporary inactivation of regions using cooling or GABA agonists like muscimol. Genetic lesions, knockout models, used in animals to study gene-specific brain function loss. B. Applications of lesion studies. Understanding the role of hippocampus in memory, amygdala in fear, basal ganglia in movement. Used to develop animal models of diseases. Parkinson's disease, lesioning substantia nigra. Huntington's disease. Stroke models. C. Limitations. Can have off-target effects e.g., damaging nearby regions or fibers of passage. Lesion effects may be compensated by other brain areas' plasticity. Ethical limitations in humans, often used in animals or studied via natural lesions e.g., stroke. 3. Stimulation techniques. Electrical stimulation. Low-intensity electrical current is applied to specific brain areas via implanted electrodes. activates neurons and mimics natural neural activity. Used in deep brain stimulation (DBS) for Parkinson's disease, OCD, depression. B. Chemical stimulation. Involves microinjection of excitatory neurotransmitters or agonists e.g., glutamate, NMDA, to activate neurons locally. C. Optogenetics. Genetically engineered light-sensitive ion channels e.g., channel rhodopsins are introduced into neurons. Light of specific wavelength is used to activate and inhibit specific neuron populations with millisecond precision. Revolutionary technique for mapping neural circuits. D. Transcranial magnetic stimulation (TMS), non-invasive stimulation in humans using a magnetic field to depolarize neurons. Used in cognitive studies and psychiatric therapy. IV. Applications of stimulation studies mapping motor cortex via stimulation. Studying reward circuitry e.g., medial forebrain bundle. Treatment of movement disorders, depression, and chronic pain. Revealing real-time cause-effect relationships in behavior. V. Differences between lesion and stimulation techniques feature lesion stimulation. Purpose determine necessity determine sufficiency effect disrupts function activates function reversibility often reversible e.g., optogenetics, TMS application behavior loss on damage behavior induction on activation V. CSIR net relevant concepts. Lesions help determine if a region is necessary for a function. Stimulation helps determine if a region is sufficient to produce a behavior. Optogenetics offers cell-type specific and temporally precise control. Reversible lesions are used to avoid permanent damage and assess transient effects. 7. CSIR net previous year questions 1. CSIR net Deck 2018. A neuroscientist uses electrical stimulation of a specific brain region to evoke feeding behavior in rats. What conclusion can be drawn from this? A. The region is necessary for feeding. B. The region is sufficient to initiate feeding. C. The region is not related to feeding. D. Lesioning this region will increase feeding. Answer. B. The region is sufficient to initiate feeding. 2. CSIR net June 2016. Excitotoxic lesions differ from electrolytic lesions in that A. They damage axons more than cell bodies. B. They spare cell bodies but destroy axons. C. They selectively destroy cell bodies but spare fibers of passage. D. They are only used in humans. Answer. C. They selectively destroy cell bodies but spare fibers of passage. 3. CSIR net Deck 2020. Optogenetics is advantageous over electrical stimulation because it A. is nonspecific. B. has poor temporal resolution. C. can target specific neuron types with high temporal precision. D. is irreversible. Answer. C. can target specific neuron types with high temporal precision. Would you like the next topic to be fluorescence techniques, GFP, FRET, FRAP, or continue with other neurophysiological or molecular biology techniques? You said, no table chat GPT said. Got it. Here's a revised CSIR Net Life Sciences-oriented high-quality theory lecture on lesion and stimulation of the brain, with no tables, fully in paragraph format, maximum detail, and previous year questions with answers included. Lesion and stimulation of the brain. Introduction. The brain is an incredibly complex organ, and to understand the specific roles of different brain regions, neuroscientists use two major experimental strategies, lesion techniques and stimulation techniques. Lesion techniques aim to disrupt or eliminate the activity of a specific brain area and observe the behavioral or physiological effects, thereby identifying regions that are necessary for a given function. In contrast, stimulation techniques involve activating a brain region and observing the outcomes, thereby identifying areas that are sufficient to drive specific behaviors or physiological processes. 2. Lesion techniques. Lesioning refers to the intentional damage or removal of a particular brain area in order to study the consequences of its loss. The most traditional method is surgical ablation, in which a defined area of the brain is surgically removed. Electrolytic lesions use high-frequency electric currents delivered through an electrode to destroy the targeted brain tissue. While this technique is relatively precise in targeting, it may also damage nearby fibers of passage, which can lead to confounding results. Excitotoxic lesions involve the injection of neurotoxins such as chenic acid or ibotenic acid. These toxins selectively destroy neuronal cell bodies by overactivating glutamate receptors, while sparing the axons that merely pass through the area. This makes excitotoxic lesions more specific than electrolytic ones. Reversible lesion techniques, such as local cooling or administration of GABA agonists like Muscimol, allow temporary inactivation of brain regions. These are especially useful in experiments where reversible and repeatable control of brain function is needed. In addition to physical and chemical methods, genetic lesions are created in animal models using knockout technology, where specific genes are deleted to observe their impact on brain function and behavior. Lesion techniques are used in experimental studies to determine the necessity of a brain region for a particular function. For example, lesioning the hippocampus impairs memory formation, supporting its essential role in learning and memory. Similarly, destruction of the amygdala reduces fear responses. In animal models, lesions to the substantia nigra are used to mimic Parkinson's disease symptoms. However, one of the limitations of lesion studies is neuroplasticity, where other brain regions may compensate for the loss of function over time. Furthermore, some lesion techniques can be nonspecific and may affect unintended regions, making interpretation of results challenging. 3. Stimulation techniques. Stimulation techniques provide the opposite approach. Instead of destroying tissue, these methods activate specific brain areas to determine whether they are sufficient to induce certain behaviors or responses. Electrical stimulation involves placing electrodes in or on the brain and applying low-voltage electrical currents to activate neurons. This technique has historically been used to map brain areas responsible for movement, emotion, and reward. For instance, stimulation of the motor cortex can elicit muscle movements, while stimulation of the medial forebrain bundle induces pleasure-seeking behaviors. Chemical stimulation involves the microinjection of neurotransmitter agonists or other excitatory compounds into a target brain region to activate neurons. This allows for more localized and pharmacologically specific activation. More recently, optogenetics has revolutionized stimulation studies by providing precise control over genetically defined populations of neurons. In this technique, light-sensitive ion channels such as channel rhodopsins are introduced into specific neurons using viral vectors. These neurons can then be activated or inhibited using light pulses of specific wavelengths. Optogenetics offers millisecond precision and high cell-type specificity, making it an invaluable tool in behavioral neuroscience. Another non-invasive stimulation method used in humans is transcranial magnetic stimulation, TMS. TMS involves placing a magnetic coil near the scalp to generate a changing magnetic field, which induces electrical currents in the underlying brain tissue. It has been used for cognitive neuroscience studies and in the treatment of psychiatric disorders such as depression. IV. Comparative functional role. Lesion techniques allow researchers to determine whether a brain region is necessary for a function by showing what happens when it is removed or inactivated. In contrast, stimulation techniques test whether a brain region is sufficient to produce a function by observing the outcomes when it is artificially activated. For example, lesioning the hippocampus may impair spatial memory, suggesting that it is necessary for this function. On the other hand, stimulating the motor cortex can cause voluntary movement, suggesting that it is sufficient to produce such behavior. Together, these methods allow a more complete understanding of the causal roles of brain areas. V. Applications. Both lesion and stimulation methods are used in clinical and experimental settings. Lesion studies have been critical in developing models of neurological disorders such as Parkinson's disease, Huntington's disease, and stroke. They have also been instrumental in understanding fundamental brain-behavior relationships. Stimulation techniques have clinical relevance in therapeutic contexts, such as deep brain stimulation (DBS), which is used to treat Parkinson's disease, obsessive-compulsive disorder, and depression. Optogenetics is a cutting-edge research tool for dissecting neural circuits in animals, while TMS offers a non-invasive means of modulating human brain activity for both research and therapy. P. CSIR-NET Previous Year Questions 1. CSIR-NET Deck 2018. A neuroscientist uses electrical stimulation of a specific brain region to evoke feeding behavior in rats. What conclusion can be drawn from this? Answer. The region is sufficient to initiate feeding. Explanation. Since electrical stimulation evokes the behavior, it indicates sufficiency, not necessity. 2. CSIR-NET June 2016. Excitotoxic lesions differ from electrolytic lesions in that. Answer. They selectively destroy cell bodies but spare fibers of passage. Explanation. Excitotoxins overactivate neurons causing their death, but do not affect axons passing through the region. 3. CSIR-NET Deck 2020. Optogenetics is advantageous over electrical stimulation because it, answer, can target specific neuron types with high temporal precision. Explanation. Optogenetics uses light to control specific genetically modified neurons, offering unmatched precision. Would you like to move on to fluorescence-based techniques like GFP, FRET, and FRAP next, or should we continue with another electrophysiological or molecular technique? You said. Pharmacological testing, ChatGPT said. Here is your CSIR-NET Life Sciences-oriented, high-quality theory lecture on pharmacological testing, with full detail, paragraph format, and previous year questions with answers included, strictly without any tables. Pharmacological testing Introduction. Pharmacological testing refers to the systematic study of drugs and their effects on biological systems. It is a critical method in physiology, pharmacology, and neuroscience, used to understand how various chemical substances interact with cells, tissues, and organs. The main objectives of pharmacological testing include evaluating the efficacy, potency, and safety of compounds, as well as identifying their specific targets and mechanisms of action. In the context of neurobiology and behavior, pharmacological testing helps in determining how specific neurotransmitters, receptors, enzymes, and ion channels influence brain function and behavior. 2. Key concepts in pharmacological testing. Pharmacological testing typically involves the administration of agonists, antagonists, inhibitors, or modulators of specific molecular targets. Agonists are substances that bind to and activate receptors, mimicking the effect of natural ligands. Antagonists, in contrast, bind to receptors but block or inhibit their activity. Inhibitors are often used to block enzymatic activity, for example, the inhibition of acetylcholinesterase to increase acetylcholine levels in synapses. Pharmacological testing can be performed both in vitro, such as cell cultures, tissue slices, or biochemical assays, and in vivo, in whole organisms such as model animals or humans. One of the most powerful applications of pharmacological testing is to reveal the functional role of specific neurotransmitters or signaling pathways. For instance, the injection of dopamine receptor antagonists can help determine the role of dopamine in motor control and reward. Similarly, the application of NMDA receptor antagonists, such as APV, 2-amino-5-phosphonobylaric acid, has been used to study synaptic plasticity and learning. 3. Experimental design in pharmacological testing. Effective pharmacological testing requires careful experimental design. This includes choosing appropriate controls, such as vehicle-only injections, determining optimal dosing regimens, and ensuring specific targeting of the compound. The route of administration is also important and may include systemic routes such as oral, intraperitoneal, or intravenous, or localized routes such as intracerebral microinjection. Time course studies help to understand how long the drug acts and at what time points its effects are maximized. Moreover, dose-response experiments allow for the determination of the minimum effective dose and the dose at which side effects or toxic effects begin to emerge. The specificity of a drug's action is confirmed by using structurally similar and active compounds as controls or by testing the compound in genetically modified animals lacking the target receptor or enzyme. Behavioral, electrophysiological, biochemical, or imaging readouts are commonly used to assess drug effects. For example, open field tests, maze tests, or conditioned place preference assays can be used to evaluate behavioral outcomes after drug administration in animals. IV. Applications of pharmacological testing. Pharmacological testing has widespread applications. It is used in basic research to study neurophysiological mechanisms, in translational research to model human diseases, and in drug discovery to screen potential therapeutic compounds. For example, drugs that inhibit monoamine oxidase are tested in models of depression to assess their ability to elevate monoamine levels and reverse depressive-like behaviors. In neurodegenerative disease models, such as those for Alzheimer's or Parkinson's disease, pharmacological agents targeting specific neurotransmitter systems or protein aggregates are tested for their capacity to alleviate symptoms or slow disease progression. In addition, pharmacological testing is used to dissect neural circuits by temporarily activating or inhibiting specific components. For example, muscimol, a GABA receptor agonist, can be used to temporarily inactivate specific brain regions, allowing researchers to investigate their roles in cognition or emotion. Similarly, systemic administration of serotonin reuptake inhibitors, SSRIs, helps study the impact of serotonergic modulation on anxiety and mood-related behaviors. The limitations and considerations. Although pharmacological testing provides valuable insights, there are several limitations to consider. Drug effects may be nonspecific, affecting multiple targets at once. Systemic administration may produce off-target effects or affect multiple brain areas simultaneously. Additionally, compensatory mechanisms in the organism may mask the true effect of a drug, especially in chronic treatments. Species differences between animal models and humans may also limit the translational applicability of the findings. Therefore, it is essential to use complementary methods such as genetic knockouts, optogenetics, or imaging to validate pharmacological results. P. CSIR-NET Previous Year Questions 1. CSIR-NET June 2019. A researcher uses a selective serotonin reuptake inhibitor, SSRI, to study its effects on anxiety in mice. The administration of the drug leads to a reduction in anxiety-like behavior. What does this result suggest? Answer. The serotonergic system is involved in modulating anxiety. Explanation. SSRIs elevate serotonin levels by preventing its reuptake, and the behavioral outcome implies that increased serotonin reduces anxiety. 2. CSIR-NET Deck 2020. A drug that selectively binds and activates dopamine D1 receptors is administered to a rat. The animal exhibits increased locomotor activity. What is the most likely interpretation? Answer. Activation of dopamine D1 receptors enhances motor activity. Explanation. Dopamine plays a major role in motor regulation, and D1 receptor activation is associated with excitatory effects on movement. 3. CSIR-NET June 2016. Which of the following is true regarding the use of antagonists in pharmacological studies? A. They mimic the action of endogenous ligands. B. They block receptor activity. C. They degrade neurotransmitters. D. They increase neurotransmitter release. Answer. They block receptor activity. Explanation. Antagonists bind to receptors and prevent the action of endogenous neurotransmitters without activating the receptor themselves. Let me know if you'd like the next lecture on GFP, FRET, and FRAP techniques, or any other CSIR-NET topic. You said, PET. ChatGPT said. Here is your CSIR-NET Life Sciences-oriented high-quality theory lecture on PET positron emission tomography, with maximum detail, paragraph format only, and previous year questions with answers and year included, strictly without any tables. Positron emission tomography, PET, Introduction. Positron emission tomography, PET, is a non-invasive imaging technique used to visualize and quantify metabolic and physiological processes in living organisms. It is especially powerful in neuroscience, physiology, and clinical medicine, as it allows researchers to observe brain activity, receptor binding, blood flow, glucose metabolism, and neurotransmitter dynamics in real time. Unlike structural imaging techniques like MRI or CT, PET is a functional imaging modality, making it invaluable for studying dynamic biological processes. 2. Principle and mechanism. PET relies on the detection of gamma rays produced by the annihilation of positrons emitted from a radioactive tracer. The process begins with the administration of a biologically active molecule labeled with a positron-emitting radionuclide, such as fluorine 18-18F, carbon 11-11C, or oxygen 15-15O. These isotopes decay by emitting positrons, anti-electrons. When a positron encounters an electron in tissue, the two annihilate, producing two gamma photons that move in opposite directions, approximately 180 degrees apart. PET scanners detect these pairs of photons simultaneously, coincidence detection. By triangulating the origin of the photon pairs and reconstructing the data using complex algorithms, a 3D image of the tracer distribution within the body or brain is generated. The pattern and intensity of the signal correspond to the location and concentration of the radio-labeled compound, providing insights into the underlying physiological processes. 3. Tracers and functional applications. The most commonly used PET tracer is CARAT18F fluorodeoxyglucose, CARAT18F FDG, a glucose analog. Once administered, FDG is taken up by metabolically active cells but is not metabolized further, leading to its accumulation. Thus, areas with high glucose uptake, such as tumors or active brain regions, show strong PET signals. In neuroscience, FDG PET is used to assess regional brain activity, diagnose Alzheimer's disease, epilepsy, and schizophrenia, and monitor the effects of drugs on brain function. Another important tracer is CARAT11C raclopride, which binds to dopamine D2 receptors, allowing PET imaging of receptor availability and dopamine release in the brain. PET with radiolabeled ligands is also used to study serotonin, acetylcholine, and other neurotransmitter systems. Additionally, CARAT15O labeled water can be used to measure regional cerebral blood flow. IV. Strengths and advantages. PET offers several advantages over other imaging methods. It provides high sensitivity in detecting functional changes at the molecular and cellular levels before structural changes become apparent. Its ability to quantify absolute concentrations of biochemical compounds makes it an essential tool in pharmacology and receptor occupancy studies. Furthermore, PET can be combined with CT, PET-CT, or MRI, PET-MRI for anatomical localization, enhancing spatial resolution and interpretability. The limitations. Despite its strengths, PET has several limitations. The spatial resolution of PET is lower than that of MRI or QUART. The use of radioactive tracers limits repeated usage and requires specialized facilities, including a cyclotron for isotope production and radiochemistry labs for tracer synthesis. The short half-lives of many isotopes, e.g., CARAT15O has a half-life of only 2 minutes, necessitate rapid image acquisition and immediate availability of the tracers. PET is also relatively expensive and may not be accessible in all research or clinical settings. P. Research and clinical applications. In neuroscience research, PET is used to study brain metabolism, neurotransmitter systems, neuroreceptor mapping, and drug mechanisms. Clinically, it is used to diagnose and monitor neurological disorders, including Parkinson's disease, Alzheimer's disease, brain tumors, and epilepsy. In oncology, PET detects metabolically active tumors and assesses response to therapy. In cardiology, it evaluates myocardial viability and perfusion. PET is also a powerful tool in pharmacological testing. By labeling drug molecules or their targets, researchers can track distribution, receptor binding, and efficacy in real time. This is especially important in CNS drug development, where crossing the blood-brain barrier and target engagement need to be verified. 7. CSIR-NET Previous Year Questions 1. CSIR-NET Deck 2018. Which of the following statements is correct regarding PET imaging? A. PET directly detects positrons emitted by radioactive isotopes. B. PET provides high-resolution structural images of the brain. C. PET detects gamma rays resulting from positron-electron annihilation. D. PET uses X-rays to generate 3D images. Answer. C. PET detects gamma rays resulting from positron-electron annihilation. Explanation. PET relies on coincidence detection of gamma photons produced when a positron meets an electron. 2. CSIR-NET June 2017. A neuroscientist uses CARAT11C raclopride PET to study the brain of a subject under a rewarding stimulus. A decrease in PET signal is observed in the striatum. What does this indicate? Answer. Dopamine release in the striatum displaces CARAT11C raclopride from D2 receptors. Explanation. Endogenous dopamine competes with raclopride for binding, reducing PET signal when dopamine levels rise. 3. CSIR-NET Deck 2021. Which PET tracer would most likely be used to study cerebral glucose metabolism? Answer. CARAT18F fluorodeoxyglucose, CARAT18F FDG. Explanation. FDG is a glucose analog and is commonly used in PET to assess metabolic activity in the brain. Would you like to continue with MRI, optogenetics, or move to another section in the CSIR-NET syllabus? You said, MRI. ChatGPT said. Here is your CSIR-NET Life Sciences-oriented high-quality theory lecture on MRI, magnetic resonance imaging, in detailed paragraph format, covering all critical concepts and including CSIR-NET previous year questions with answers and years, strictly without any tables. Magnetic resonance imaging, MRI, Introduction. Magnetic resonance imaging, MRI, is a powerful non-invasive imaging technique widely used in medical and biological research to visualize the internal structure of organs and tissues, especially the brain and spinal cord. Unlike PET or CT, which involve ionizing radiation, MRI relies on magnetic fields and radio frequency pulses, making it safer for repeated use. In neuroscience and life sciences, MRI plays a central role in anatomical imaging, brain mapping, and functional studies such as blood flow and activity patterns. 2. Principle of MRI. MRI works based on the principle of nuclear magnetic resonance, NMR. The human body contains a large number of hydrogen atoms, mainly in water and fat. Each hydrogen nucleus acts like a small magnet due to its spin. When a strong external magnetic field is applied, these spins align either parallel, low energy, or anti-parallel, high energy, to the field. A radio frequency, RF, pulse is then applied, causing the aligned nuclei to absorb energy and flip their orientation. When the RF pulse is switched off, the nuclei return to their original state, releasing energy in the form of detectable signals. These emitted signals vary depending on the local environment of the hydrogen nuclei, such as tissue type, water content, etc., and are detected by receiver coils. Advanced computational algorithms process these signals to construct high-resolution images. The time taken by the nuclei to relax back to their equilibrium states is characterized by parameters such as T1, longitudinal relaxation time, and T2, transverse relaxation time, which are key to image contrast. 3. Types and contrast mechanisms. MRI can produce different types of images depending on how it is set up. T1 weighted images provide excellent anatomical detail and are good for visualizing fat and gray matter. T2 weighted images highlight fluid-filled areas, making them useful for detecting edema or inflammation. Proton density (PD) imaging balances T1 and T2 to show tissue differences based on hydrogen content. Functional MRI (fMRI) is a specialized MRI technique that detects changes in blood oxygenation level dependent both signals. Active brain areas consume more oxygen, and fMRI can detect the resulting changes in magnetic properties of hemoglobin. This allows mapping of brain function in response to tasks or stimuli, making fMRI essential in cognitive neuroscience and brain mapping. IV. Applications of MRI. MRI has revolutionized neurobiology, clinical diagnosis, and brain research. It provides high-resolution images of soft tissues, including the brain, spinal cord, muscles, and organs. In neuroscience, MRI is used to identify structural abnormalities, tumors, lesions, atrophy, measure brain volume, map white and gray matter, and study neurodevelopment and degeneration. Functional MRI (fMRI) allows real-time monitoring of brain activity, enabling the localization of regions involved in memory, language, motor control, and emotion. In addition, diffusion tensor imaging (DTI), another MRI-based method, maps white matter tracts and connectivity between brain regions by measuring the diffusion of water molecules along axons. The advantages and limitations. MRI offers excellent spatial resolution, non-invasiveness, and safety due to the absence of ionizing radiation. It allows for repeated scans and long-term monitoring. Functional imaging with fMRI adds a layer of temporal resolution, making it useful for dynamic studies. However, MRI also has limitations. It is sensitive to movement, which can distort images, especially in incooperative subjects or young children. The cost of MRI machines and scans is high, and the technique requires shielding from external magnetic noise. Claustrophobic patients may find it uncomfortable due to the enclosed scanner space. Moreover, fMRI has lower temporal resolution compared to electrophysiological methods and reflects indirect measures of neural activity via blood flow, not direct neuronal firing. P. CSIR-NET Previous Year Questions 1. CSIR-NET June 2018. Which of the following imaging methods is most appropriate to non-invasively measure brain structure with high spatial resolution? A. PET. B. CT circa MRI DEEG. Answer. CMRI. Explanation. MRI provides detailed structural images of the brain without using ionizing radiation, offering superior spatial resolution. 2. CSIR-NET DEC 2019 Functional MRI (fMRI) is based on electrical activity of neurons, B optical density of tissue, C blood oxygenation level dependent both signals, D calcium imaging. Answer. C blood oxygenation level dependent both signals. Explanation. fMRI measures changes in deoxyhemoglobin concentration that correlate with neural activity via bold contrast. 3. CSIR-NET June 2020. In MRI, which property of hydrogen nuclei is exploited for imaging? A. Charge. B. Mass. C. Spin and magnetic moment, D. Conductivity. Answer. C. Spin and magnetic moment. Explanation. MRI relies on the nuclear spin and magnetic properties of hydrogen atoms to generate contrast in tissues. Let me know if you want the next lecture on optogenetics, calcium imaging, or any other CSIR-NET life sciences topic. You said, fMRI. ChatGPT said. Here is your CSIR-NET Life Sciences Oriented Theory lecture on fMRI, functional magnetic resonance imaging, in maximum detail paragraph format, strictly without any tables, and including previous year CSIR-NET questions with answers in years. Functional magnetic resonance imaging, fMRI, Introduction. Functional magnetic resonance imaging, fMRI, is a non-invasive neuroimaging technique used to study brain activity by detecting changes associated with blood flow. It builds upon the principles of conventional MRI but is uniquely sensitive to the physiological changes that occur in the brain in response to neural activity. As neurons become more active, they consume more oxygen, leading to localized changes in blood oxygenation. These changes are detected using fMRI, which allows researchers and clinicians to infer which areas of the brain are active during specific tasks, sensory stimulation, or rest. 2. Bold signal and basic mechanism. The most widely used fMRI technique is based on the blood oxygenation level dependent bold signal. Bold fMRI exploits the magnetic differences between oxygenated hemoglobin, oxyhemoglobin, and deoxygenated hemoglobin, deoxyhemoglobin. Oxyhemoglobin is diamagnetic, non-magnetic, whereas deoxyhemoglobin is paramagnetic, slightly magnetic. When neurons in a specific brain region become active, they require more oxygen. In response, local blood vessels dilate, increasing blood flow and delivering an excess of oxyhemoglobin. Paradoxically, this oversupply of oxygenated blood decreases the concentration of deoxyhemoglobin in that region, leading to a reduction in local magnetic field inhomogeneities. This change results in an increase in the MRI signal, which is detected as a bold signal increase. The temporal changes in bold signal are correlated with brain activity, allowing the generation of activation maps that show which brain regions are involved in particular cognitive or motor tasks. 3. Experimental design in fMRI studies. fMRI experiments typically involve carefully controlled designs to compare brain activity under different conditions. There are two main types of designs, block design and event-related design. In block design, stimuli or tasks are presented in alternating blocks, e.g., task versus rest, while in event-related design, individual stimuli are presented at specific times and responses are recorded. The data acquired during an fMRI scan consists of a time series of brain images. Statistical methods, such as general linear models, GLMs, are applied to identify regions where the signal correlates with the experimental condition. These regions are interpreted as being functionally active during the task or stimulus presentation. IV. Applications of fMRI. fMRI has transformed our understanding of brain function. It is widely used in cognitive neuroscience to study memory, attention, language, emotion, and decision-making. It has been used to map the default mode network, sensory cortices, motor areas, and language centers like Broca's and Wernicke's areas. Clinically, fMRI is used in presurgical mapping to avoid critical functional areas during brain surgery, especially in epilepsy and tumor resection. It also helps in understanding neurological and psychiatric disorders like schizophrenia, depression, autism, and Alzheimer's disease. Recent advancements include resting state fMRI, which maps functional connectivity of the brain during rest, offering insights into intrinsic brain organization. The advantages and limitations. fMRI offers excellent spatial resolution on the order of millimeters, making it ideal for identifying fine anatomical structures involved in function. It is non-invasive, requires no radioactive tracers, and can be repeated multiple times. However, fMRI has limited temporal resolution on the order of seconds due to the slow nature of the hemodynamic response compared to the rapid firing of neurons. The bold signal is an indirect measure of neuronal activity and can be influenced by non-neural factors such as vascular reactivity. Movement artifacts, scanner noise, and complex data analysis pipelines also pose challenges. Recent trends. Advancements in fMRI include high-field scanners, 7 Tesla and above, for better resolution, multi-band imaging for faster acquisition, and integration with other modalities like EEG-fMRI or PET-fMRI for comprehensive understanding of brain function. Machine learning and deep learning methods are increasingly used to analyze complex fMRI datasets and decode mental states or disease signatures. 7. CSIR-NET Previous Year Questions 1. CSIR-NET DEC 2019. Which of the following techniques is used to detect brain activity based on changes in blood oxygen levels? A. EEG. B. fMRI. C. PET-DMEG. Answer: B. fMRI. Explanation: fMRI detects brain activity through bold signals based on local oxygenation changes. 2. CSIR-NET June 2021. Bold signal used in fMRI reflects electrical activity of neurons. B. Direct measurement of synaptic potential. C. Blood oxygenation levels due to neural activity. D. Neuronal calcium influx. Answer: C. Blood oxygenation levels due to neural activity. Explanation: bold signals are based on hemodynamic responses to local neuronal activation. 3. CSIR-NET DEC 2018. Which of the following imaging techniques is non-invasive and provides information on regional brain function? A. CT. B. Ultrasound. C. fMRI. D. SPECT. Answer: C. fMRI. Explanation: fMRI is a non-invasive method that maps functional activity using bold contrast. Let me know if you want the next lecture on calcium imaging, optogenetics, or another topic from the CSIR-NET Life Sciences syllabus. You said, Cat. ChatGPT said. Here is your CSIR-NET Life Sciences Oriented Detailed Theory lecture on CAT Computerized Axial Tomography, or CT Computed Tomography, in maximum word limit paragraph format, with no tables, and including CSIR-NET previous year questions with answers in years. Computed Axial Tomography, CAT, CT Scan, Introduction. Computed axial tomography, CAT, more commonly referred to as CT scan, is a sophisticated imaging technique that utilizes X-ray technology and computer processing to create detailed cross-sectional images of the internal street. Finished thinking. Microscopic technology.